How do you mean no more commission?
Well, no one in Scotland can commission an idea. You know, if I went to BBC Scotland and I said, oh, I've got this great idea for a sitcom, I've got this brilliant idea for a drama, you know, there isn't one person in Scotland that can okay it unless it goes through London.
Good morning and welcome to another edition of Full Scottish. What's happening today?
Hello and welcome to the Full Scottish here on Broadcasting Scotland.
Scotland is going to be an independent country.
That need, that desire for independence is ever stronger than perhaps it was in 2014. So there's an obligation that we've got to give leadership to that campaign. That's what Nicola Sturgeon, as our First Minister, has been doing.
My feeling about Boris Johnson is he can't be trusted on anything.
That is now and forever will be known as the rape clause.
I'm old enough to remember going into Europe in '73, and I remember how much of a razor's edge that was a battling stone. And I think we made it by 53%, if I remember correctly, for going in. And ever since that time, England particularly has been pretty much schizophrenic, down the middle about whether it felt British or whether it felt European. And that schism, that crack has remained throughout English society ever since.
Scotland means business. Scotland's voice won't be stilled, it won't be silenced, it has to be heard.
The work that's been done by Broadcasting Scotland in giving community activists, yes activists, Scottish activists a platform other than the traditional media outlets.
Well, it's lovely to be out on such a sunny evening in Edinburgh, but it's a shame that we have to be out tonight protesting against the two-child cap and the rape clause. Well more than a year since Alison Thewlis, my colleague at Westminster, first spotted it in the small print of a Tory budget.
Very glad to see such a huge demonstration today and so many people still coming along 1 year after the rape clause came into force to show their opposition to this vile and despicable policy. The UK government have never been able to justify this policy, and we saw that this week with Esther McVeigh's pathetic attempts to say that the rape clause was somehow double support for women and that gives them some kind of chance to talk about the most appalling and disturbing experience of their life.
As you can see behind me, we're at the very beginning of the All Under One Banner rally. You can obviously hear the pipers behind me as events are about to kick off.
It's time to aim high, look resolutely outwards, and never, ever accept second best. Above all, it's time to believe that we can. We can build that better country we know is possible. And friends, we will.
If you enjoy watching our programmes, please help us to be Scotland's independent broadcaster by signing up to become a Broadcasting Scotland supporter.
Advice and the guidance that we receive. Of course, working together in a meaningful way requires discussion and not simply the communication of decisions taken. We know that lockdown, whilst there to prevent harm, does itself cause harm in other areas of health, including mental health, well-being, to our economy and to our communities. So while progress has been made, and we have the evidence of that in the sustained downward trend of new cases, hospitalisation, including in ICU, and indeed, whilst not wanting to diminish in any way the impact on those who've lost a loved one, declining number of deaths, and today's published data on the estimated R number for Scotland. But we do need to be clear that the virus has not gone away, and the virus does not transmit itself. People do that. So as we recognise progress, we need to also recognise that the headroom that progress gives us at this point is small, and our easing of the lockdown needs to be planned, thoughtful, gradual and steady, allowing time to measure impact on the way out, as we did on the way in, and paralleled with key actions such as our Test and Protect programme to manage the emergence of cases and lockdown transmission. That is the approach we have taken in moving from lockdown to phase 1 of our route map, which is where we are now, and the approach we will continue to take. And next Thursday, a week today, we will publish our decisions in terms of that 3-week review period and whether or not we believe we can then move into phase 2 of our government route map, and if so, to what extent? To full extent, partial extent, or in what manner might we do that? It is also an approach, that thoughtful, steady and safe way, that we are cognizant of as we safely and gradually restart those areas of healthcare that we paused to deal with the pandemic. And members may know that last week I published the framework for decision making in the remobilisation, the recovery and the redesign of NHS in Scotland. With that, Chair, I will pause, and I'm very happy to take whatever questions your colleagues want to ask, and where appropriate, I will ask Professor Leitch to contribute as well.
Grateful, and thank you ever so much for that. I appreciate you're both very, very busy just now, so we won't try to delay you inordinately just now and let you get back to your very, very important work. I think you've identified in your introductory remarks that we have a specific interest in the Four Nations approach, how it has worked, how efficient it has been, the type of operational independence national governments may have to implement its own priorities. So could you perhaps just describe to us, please, Cabinet Secretary, just how this works? What is your engagement and involvement? How are decisions taken? And how is there then an expectation that this would then be managed and implemented across the Four Nations?
So thank you for that. There are a number of points in there, and there are, I think, this is an evolving process. So at the outset, as you will know, the Four Nations came together using the advice that came primarily through SAGE, that consensus approach to the scientific advice, and crafted and agreed and published at the same time the Four Nation Plan, which set out the phases that we would individually in each of our countries and collectively work our way through, from containment through to delay and so on. At that point, there was, I think it's fair to say, considerable interrelationships and discussions. That still continues, I think it's important to say this, between our respective chief medical officers. Professor Leitch might want to say a bit more about that level of clinical and scientific engagement. We have, as you know, established our own advisory group to the Chief Medical Officer here in Scotland with Professor Andrew Morris. I know he gave evidence to you before, and he is a member of SAGE and takes the work of SAGE and applies that with other colleagues, some of whom are involved in SPI-M or SPI-B, and applies that to the particular situation in Scotland as we confront it. So there has been significant engagement throughout by scientists and clinicians, as you would expect. That is the nature of the scientific and the academic community. I have to say, though, that the engagement at senior ministerial and political level has not been as consistent as we would wish it to be. The last COBRA meeting was the 10th of May, and as you know, a number of further decisions, of course, in the respective nations of the UK have been taken subsequent to that. And that really is part of my point that I made in my opening remarks, that cooperation and collaboration requires discussion. It's not simply the communication of decisions. I know that the Prime Minister and the First Ministers have had calls. I personally have a weekly call with my 4 counterparts, Von Gethin from Wales, Robin Swan from Northern Ireland, and of course Matt Hancock as the Secretary of State, where we discuss some issues around that are pressing in terms of health matters around PPE or test and trace and so on. But recently, the ministerial implementation groups are to be disbanded and replaced, I understand, by 2 other committees, but not clear at all yet in what way will the other governments from Wales, Northern Ireland or ourselves be involved in that. So we have some concern about the continuation in practical terms, in discursive and decision-making terms between the 4 nations. Although we, I do think, have reached a view that there are certain areas quite clearly that are for the individual devolved governments to take, given the respective responsibilities, and that we may move in terms of the UK as a whole at a different pace in each.
Can I come to that directly, Cabinet Secretary, if you don't mind, because this is really quite important to us, because I think the view is that it was quite easy to put together the 4 nations and there was general buy-in and acceptance. All the things you've described about the fact, you know, we are one United Kingdom with 4 different jurisdictions. It was important that we did work together. It seems to be a little bit more frayed as we're coming out the other end, with all respective governments doing different things in their approaches to leaving lockdown. Does that mean that the 4 nations concept is basically dead or dying, or is there still something that we could refer to as a 4 nations as we leave lockdown just now?
Well, I would, for the very reason that I said at the outset, that the virus is not a respecter of boundaries, and that 4-nation plan was a very positive start that recognised our respective responsibilities but came together to reach a shared view. I think that remains important, and we continue to work to try and achieve that. But what I don't understand and can't answer for you is why COBRA has not met since the 10th of May. Our own Scottish Government resilience meetings in terms of our cross-government at cabinet level meetings continues. The last one was Friday that is just gone. But COBRA seems to me to be an important place for that 4-nation cooperation to be undertaken in a very practical sense at that political level. And the disbanding of the ministerial implementation groups with nothing in its place that has involved any discussion yet with this government, and therefore we don't know whether there is a role there or not, is of concern. But our commitment remains to do what we can to secure 4-nation cooperation.
I'm grateful for that. I saw you earlier with the First Minister at the daily press briefings that happens, I think, from Bute House, and I know that Professor Leitch is a regular attender at that too. I understand that there's going to be an announcement about our move to phase 2 next week. I think that's correct, isn't it? I'm just wondering, like, given that we talk about refer to phases where the UK government refers to the steps that they're taking, is there any great difference about what we're doing coming out of lockdown to the UK government? And if there is a difference, what is it?
So you're right, our briefings happen every day of the week apart from Saturday, and on Wednesdays First Minister is in our Parliament doing a version of that, but to parliamentarians. The phases that are there between our route map out of lockdown and the UK government's approach. There are many similarities in that, but what we are very clear to do, and of course as we approach next Thursday, we are being pressed as we were today to make announcements and decisions in advance of the review date, and we are resisting that because we believe that the progress that has been made so far has been made as a consequence of taking time to review the evidence that comes from those numbers that we announced today, from the estimate of the R number and of infectious cases, and from what SAGE and our own advisory group advises us, that you need to see the impact of lockdown measures before you can decide to move to the next stage. Just as we saw the impact going in, we need to see that going out, and that takes time. It takes 2 to 3 weeks to be able to measure that. And so our approach, I think, differs from what I observe of the UK government's approach, in that we are much more phased and planned and resisting the pressure to make announcements between times, because we don't consider that that is either helpful in the public understanding what we're doing. We do require their compliance and cooperation significantly, and we have to date secured that to a significant degree. We wouldn't want to squander that by not planning how we are going to release lockdown. In other words, having all the key stakeholders with us, the guidance ready, so that the date that we say we're going to do X or Y, we are actually ready to do it on that date and deliver.
Thanks. And lastly, maybe this is one for Professor Leitch. When I've been down here, I've been quite surprised that most of the debate in Westminster seems to be all about the 2 metre versus 1 metre rule and principles, and there's a question about the science to all of this. But there was good news today in the conference, I believe, about the levels of infection across Scotland, and Professor Leitch could confirm this perhaps, that our R rate is now between 0.6 and 0.8. Is there a feeling that we're starting to get through this? And if we are starting to get through this, how do we continue to put the important message about staying at home and ensuring that we're keeping the community safe across in Scotland? And that's to Professor Leitch.
I think there is indication that we are, in your words, getting through it. There is also indication that we are not through it. And we need to be very cautiously optimistic. I think there are now green shoots of seeing the end of this first phase of the pandemic, but those of us giving the clinical and scientific advice to the decision makers, and that's a very important distinction, are cautious, but we are also relieved. I don't like celebrating fewer deaths. It doesn't feel like the right thing to do, because every death is completely tragic, and as the Cabinet Secretary said, there are families mourning people from deaths yesterday of this disease, not just 2 months ago. So we need to keep that in perspective. However, it does appear that we are now in a position where we can advise ministers and elected members of Parliament that we are at a point where we can start moving through the lockdown phases. Now, the nature of that moving will, of course, be up to the elected people. It will be up to the Cabinet and the First Minister and Ms Freeman. So I am encouraged. The R number is in a good place. The number of hospital admissions, ICU admissions and deaths are all consistently and sustainably down. But we're 5 weeks into that. We're not 5 months into that. So we need to be careful and proportionate to that data.
Grateful. Okay, we'll now go across to John Lamont. John.
So, thank you, Chairman. Thank you, Cabinet Secretary and Professor Leitch. Just a few questions from me. In relation to care homes and testing, in Scotland, how many people who live and work in care homes have been tested for coronavirus?
So the figures that we published yesterday, if you just give me a moment to find them, the figures that we published yesterday were both the figures for the last week the week ending the 7th of June, and the cumulative figure, and that indicated, here we are, that indicated that we had a total of 18,110 staff had been tested and 15,373 staff had been tested. Now, as I'm sure you know, Mr. Lamont, that I have required our health boards, for those colleagues not from Scotland, I should just explain that our system, our NHS, is a single system and it works in delivery terms through our individual health boards to deliver our national policies, and I have now required them to produce a weekly plan that we scrutinise and is then published, which shows their planned testing in two main areas. First of all, for all care home workers, and secondly, for residents in homes that have an active case. Testing is a critical area in terms of reducing the entry of the virus into care homes and its transmission, but it is not the only important area. Proper infection prevention and control, quality PPE, staff training, and a sustainable staff rota are all important. But that is where we are at this point. That data, I should just say, does not include all the data because there is validation work still to be done that is on data that we've received that will then be published next week.
I'm grateful. I'm conscious a lot of my colleagues wish to ask questions as well, so I'm grateful for shorter answers if that's possible, Cabinet Secretary. So just to confirm, the vast majority of care workers have not been tested in Scotland?
Not at this point, but you will recall that the policy to test all care workers is a relatively new policy. Up until that point, the testing was for residents and care workers in homes that had an active case.
But the vast majority of care workers in Scotland are not currently being tested. Now moving on to testing generally, what proportion of the testing in Scotland has been undertaken by the UK mobile testing centres and what proportion has been carried out by other means?
The significant proportion of the testing is in our NHS labs. You'll know that we have scaled up from a February position of 350 tests per day in 2 labs in Scotland, where now all our mainland boards have laboratories and our island boards do satellite testing, and a testing capacity at this point just over 16,000. The Lighthouse Lab, which is part of the UK government's Lighthouse Lab programme, can test at this point up to 20,000 a day, although neither they nor we are at the full use of that capacity.
But what proportion are carried out by the UK mobile testing centres like Glasgow Airport or Edinburgh Airport or the other locations? There was one in Galashiels and the Borders.
Yes, from memory, I'm quite happy to send you the detailed figure for this. These are the drive-through centres, but from memory, the most recent figure was around about 600 or so tests. Now, that may have been yesterday, or it may have been the day before, and we will, of course, send you the exact number.
Looking at my own constituency, Salt Green's care home in Eyemouth, which you'll be familiar with, sadly has had 8 deaths, and it's been a really difficult position for the family members and those affected by it in Eyemouth and the wider Berwickshire community. Now, you'd have seen the statement yesterday from the Chief Executive of the Scottish Borders Council, where she said that there was not enough tests to do even half of the care workers and employees in the borders. Do you think there are sufficient tests available in the borders for the care workers?
Yes, I do. Now we have increased access to the UK Care Portal, and our individual boards also supplement that. Then I think that we now have sufficient testing in each of the board areas to deliver on the policy of testing care home workers and, where it is appropriate, residents.
There was 22 tests carried out last week in the borders. Do you think that's sufficient?
No, that wasn't the first question you asked me, though, Mr. Lamb.
22 care home staff were tested last week in the borders.
And that would not be sufficient, because I imagine that doesn't cover all care home workers in the borders. So the self-evident answer to that is no, that is not sufficient, which is why I have issued that requirement to our NHS boards who are responsible for delivering this, to ensure that as we go forward from last week into this week and on, all care home workers are tested. And I should make the point that that is an iterative process. Testing where someone returns a negative test is of course of limited value. You need to keep repeating that, and so our testing policy will be sustainable in the long term. Not sure if that is the position elsewhere in the UK, but it certainly is in Scotland.
Well, there's not much repetition of the 22 tests taking place in the entirety of the borders, that's for sure. You seem to be saying it's the responsibility of the health board, it's nothing to do with you. Is that a fair reflection? It's not your responsibility, it's the health board. That seems pretty shocking, if you ask me.
And it would be if that had been what I'd said, Mr. Lamont, but it isn't what I said. What I said was that, and I'm sure you know this, that in Scotland, with our single National Health Service, our delivery mechanism for all health policies is through our individual boards. So boards, of course, have a responsibility. They are accountable to me for what they do, which is why I have now issued that requirement on them that that national policy is not open to local interpretation. It has to be delivered, and that is the work that we are now doing. I should say that not all of our boards, strictly speaking, required that instruction from me, but not all of them were performing to the standard that I require.
But ultimately the responsibility for testing rests with you.
As indeed I'm sure it rests with Mr Hancock and Mr Swan and Mr Gethin.
I'm sure they'll answer for themselves. I was asking if you were responsible for the level of testing within the borders. That's fine. Thank you very much, Mr Chairman.
Can I just ask the Cabinet Secretary, I've got a facility in Perth for testing at Perth College in the car park, and one of the mobile testing facilities visited Pitlochry recently. I think it was there for 5 days. It was really poor, the amount of people who actually turned up to be tested. Is there anything more that we can do to encourage people to use these facilities when they appear in their communities?
So there's two things, I think, in response to that, Mr Wishart. We've now reached agreement with the Army, who currently have a responsibility for those mobile units, that we will make active use of them to support care home testing. And the other side of that, of course, is that up until the introduction of Test and Protect, Test and Trace for England, what we were all saying to individuals who were symptomatic was to stay at home and to isolate there, and if their symptoms got worse, to then contact the relevant health facilities. For us, that was NHS 24 and then our community COVID-19 assessment centres, which we had stood up very quickly to respond to the pandemic. The message now to the public has changed, and so we need to continue to actively promote that message, and the message is, if you have the symptoms, stay at home and immediately contact NHS 24 or through the NHS Inform website and book a test, because that is how that triggers Test and Protect, that triggers contact tracing. So at this point, what we're seeing, a low level of transmission in Scotland from the information that Professor Leitch just gave you, but a shift in the ask we are making of the Scottish public. And so that will require continued repeat marketing, advertising, which Professor Leitch does, and continuing messaging through our daily media briefings and, of course, our colleagues in the Scottish Parliament.
Okay, thank you. Go across to Alberto Costa. Alberto.
Thank you, Chairman, and good afternoon, Cabinet Secretary, and good afternoon, Professor Leitch, and thank you for appearing before this House of Commons Select Committee. You've actually answered one or two of the questions that I was hoping to ask about your main ministerial contact in the UK Government. I think you confirmed that your main ministerial contact is the Secretary of State for Health. You also said that you speak with the Secretary of State for Health along with your devolved peers weekly. Can I just ask, what are the nature of your conversations with the Secretary of State for Health and your devolved colleagues?
Thank you for your question. Okay. Yeah, by and large it is weekly, usually about 30 to 45 minutes. We have, I think, on every single one of those conversations discussed PPE. We have also discussed where we are respectively in our different, our own approaches to testing and contact tracing in terms of the number of, are we ready to launch it? How is it going? How have the first weeks gone and so on? We have discussed, I have raised with the Secretary of State the decision taken by the Department for International Trade and others that the overseas network would not support the devolved administrations in securing international orders for PPE. So we have raised that. And by and large, these are very implementation issues, although we do also discuss where we are likely to be going in policy terms, for example, around shielding, although we're not making shared decisions at that point. It's very much an exchange of information.
Thank you. What do you think you, as the responsible Minister of Scotland, can do to better the relationship in respect of the discussions that you have with the Secretary of State for Health and your devolved colleagues? I'm thinking in particular, you're saying you have weekly conversations. Is that enough? Would you like to see more frequent conversations? What proposals have you put to the Secretary of State for Health to better the communication and discussion flow between the two governments?
So I think those weekly calls are valuable for communication and discussion flow. What they are not are decision-making events. There are very few officials join us, and in that sense, there is a degree to which those weekly interactions are valuable because they can be less formal and, in some instances, franker in that exchange. But I go back to my earlier point, and that is the absence of COBRA meeting, as it has not done since the 10th of May, and my concern around the disbanding of the ministerial implementation groups, where there was the possibility of shared decision-making for an alternative that we are not yet clear what that alternative has been. And my original point was that collaboration involves shared discussion and decision-making. It does not involve the communication of announcements. So I do not know why the ministerial implementation groups are to be disbanded. I do not know what is coming in their stead. That is not my version of proper collaboration, which is based on a degree of shared respect and consultation and decision making.
Thank you. Are you in a position as a responsible Scottish Minister to make suggestions to the Secretary of State for Health and your devolved colleagues on how you should proceed?
Yes, I am. Yes, I am.
What suggestions have you or will you be making, given the comments that you've made to this committee?
Well, we have raised, not just I, but also Von Gethin from Wales, concern around the Department of International Trade's decision, for example, as I mentioned, with respect to the support of the overseas network to devolved administrations, the removal of that. We have asked about that and to have that explained and reinstated. We've also asked about the disbanding of the ministerial groups and what might come in its stead, and to have a discussion on that. And none of those have we yet had a response, although, to be fair, Mr Hancock is open in his response to those, but we've not seen any conclusion or resolution to those requests.
Well, I would hope for the sake of the people of the whole of the UK, in particular Scotland and England, that you do improve the relationship by whatever positive means that you can. I've got no further questions. Thank you very much for answering those questions.
Grateful, Alberto. Thank you very much for that. We'll now go over to Wendy Chamberlain. Wendy.
Thank you very much, Chair, and thank you, Cabinet Secretary and Professor Leitch for appearing before us today. I just want to go into a little bit more detail around what you have said around the ministerial implementation groups. When the Secretary of State for Scotland appeared before this committee, he said that the JMC, the Joint Ministerial Committees, had not met during the pandemic and that the MIGs were meeting instead. So can I ask the last time the MIGs met? And I think you're suggesting there's a bit of a vacuum there, but what other collaboration or discussions beyond the meeting with the health secretaries are currently taking place?
So it is disappointing that the JMC has not met. I think that there is certainly a feeling on our part that it could fulfil a useful function. From memory, I think the last time the MIG for Health met was 2 weeks ago, but again, I'm happy to confirm whether or not my memory is accurate in that respect. And there is currently a vacuum in terms of shared decision-making, shared discussion and decision-making at ministerial level. Now, the First Minister, I understand, has had calls both with Michael Gove and with the Prime Minister, but there has been no forums for that shared discussion and decision-making, or at that governmental level, shared information exchanges that you would have, for example, through COBRA. Notwithstanding that, it still remains the case, Professor Leitch can add to this because he has an involvement in these areas, significant interaction between the 4 chief medical officers, and of course SAGE continues to meet, and through Professor Morris and indeed our own CMO, we have an engagement with that scientific and clinical collaboration. I don't know, Jason.
Professor Leitch, do you want to add to that? Yeah, only to a couple of people have mentioned the clinical and scientific advice, and that is, as far as possible, done at a 4-country level, clearly contextualised for the nations that we are employed to advise. But there are layers of that. Each of the professional groupings, so the 4 chief nurses, talk often, in pandemic and out of pandemic. The 4 chief medical officers talk often. They are meeting in the evenings twice a week presently. And then we have a broader senior clinicians group with about 15 to 20 of us from the 4 countries. Public Health England, Public Health Scotland, the clinical directors of the system, so Steve Powis in England and I, and the chief nurses and the chief medical officers working together to try and make choices and decisions about the advice we're then going to give. So shielding is a good example. So that group would look at which elements of shielding need to be adjusted or need to be added to, and then there would be a smaller meeting to decide should we put dialysis in the shielded group or should we, and then those decisions are made at an individual country level following that individual advice. The other thing I would remind you of, that the clinical community is relatively small and the critical care doctors tend to know each other. So below the layer of that senior executive leadership of the 4 countries, I know that the critical care lead from Lothian will speak to the critical care lead in Imperial College London to learn what's happening with ICU patients at the beginning of the pandemic. And equally, the WHO will hold that ring for all of us. So they will tell us what's happening in northern Italy or what's happening in southern Spain, and we will use that to help the advice we then give both clinically to our colleagues who are in the front line and to the politicians who are making choices about lockdown or not, or whatever other element we're in that phase of the pandemic. I think the clinical and scientific advice has been very well aligned and very well done.
Thank you very much, Professor Leitch. That's encouraging to hear. I suppose the concern for me is hearing that advice, potentially where it's been given to, that there's a disconnect. Now, my understanding is that the MIGs met quite frequently. In fact, the Secretary of State for Scotland said that they were meeting 2 or 3 a day when he gave evidence previously. And I also understand that they are utilised in crisis situations. And obviously, we're moving forward in the pandemic. So, Cabinet Secretary, what's your view in terms of reconstituting the JMC, which should meet on a yearly basis, and indeed one of its primary functions is to help manage disputes or at least divergences?
So we remain supportive of the JMC as a route for all that you have described. As I said, we understand that there are to be 2 committees established as a consequence of the MIGs being disbanded, but we don't know what those are, and we don't know therefore how they might relate to the JMC. So I can't really give you a view at this point as to what I might think would be the right route. I don't want to keep repeating myself, but I do think COBRA has an important role, and we should see COBRA working effectively, because although we are moving through the initial significant phase of the pandemic, the point I want to keep stressing is that we are not out of this pandemic. And of course, we, and I imagine elsewhere in the UK, are looking ahead at what we need to do to minimise the risk of a second peak, especially as we move through the summer to autumn and winter, when other viruses will seasonally appear. And therefore, what do we need to do to anticipate and plan and use now the benefit of the knowledge we have and the understanding we have of this particular virus over the past 3 to 4 months to assist us. That will come from our scientific and clinical advisors, of course, but we need to then, I would think, take as collective a view of our approach as we possibly can.
Thank you, Cabinet Secretary. Chair, I know Mary Black wants to come in on this area as well.
Mary.
Thanks, Chair. I was just wanting to ask, first of all, my questions are for Ms Freeman, and then I've got a couple for Mr Leitch as well. So first of all, for Ms Freeman, I'm just wondering, what was the role of the Secretary of State for Scotland and the Scotland Office before this pandemic? What was the level of communication between the Scottish Government and the Scotland Office? You know, what was the normal relationship like?
I can't really comment on that, except to say that as before, as the Secretary for the Minister for Social Security, and now as the Cabinet Secretary for Health and Sport, I had no relationship in particular with the Secretary of State for Scotland. I met him on one occasion during the pandemic when Mr Hancock came to Scotland, as he did then go to Wales and I believe to Northern Ireland, and we had a late evening meeting that Mr Jack was present at. But that's not to say that other parts of the Scottish Government don't have a relationship pre the pandemic with the Secretary of State for Scotland, but in health we did not.
Okay, thank you. And I mean, you touched on it there, but what has the level of support looked like post-pandemic while we're living in it? What has that support looked like from the Scotland Office? Has there been any communication or support offered?
I have not received any communication from the Secretary of State. In normal times and on occasions during this pandemic, when it has been appropriate, then any written communication I might have with Mr Hancock would also be copied to my colleagues in Wales and Northern Ireland, and depending on its subject matter, also to the Secretary of State for Scotland. But I am not aware and can recall no conversation or no communication with Mr Jack. We did have a conversation on that Thursday evening meeting.
Thank you, that's helpful. Well, just to move across to yourself, Mr Leitch, I'm wondering from the medical perspective, because of course in the last couple of months we've seen different governments trying to get a grasp onto this pandemic, but we are now starting to see governments diverging in different directions. So given the fact that all these governments are receiving presumably the same medical advice from the same kind of bodies, I'm wondering, is there any medical explanation as to why there are such different decisions being taken by governments, or is it just the reality that that's a political decision that's happening?
I think there are two principal answers to your question. The first is that no country looks exactly like any other country, both from a geographic, demographic perspective and from the way they run their health service. So The Cabinet Secretary has rightly described our health service as an integrated health and social care system. I don't say that from a judgmental perspective. It's just different from the Welsh Health Service. They organise themselves differently. Equally, Denmark organises themselves differently too. So the nature of what we do as a country, I think, should vary according to the demographics that you face, whether you have ferries and island communities, and whether you have large sporting events or not, or however you want to make those judgments. However, on top of that, when we give the advice to the best of our ability, which unfortunately isn't exact as everybody would like, we can't say, if you do this, this will happen. We can say, if you take this bucket of headroom, or whatever you want to call it, that's mixing metaphors a little bit, so let's presume we have some headroom to play with, because we think the virus is suppressed. What you choose to use your headroom for is, I think, rightly, a judgment for the politicians in each devolved and other administration. We can give advice about things like, when the Cabinet Secretary asks me, what would you prioritise inside the National Health Service restarting? That's a legitimate question, and I would say urgent cancer care, people in pain, that list kind of writes itself. What the Cabinet Secretary and the First Minister choose to do about family get-togethers versus elite sport versus construction, I don't think is my job. I think that is up to the elected officials of the nation using our advice to make those judgments. So we can go some way to making those decisions easier, but in the end, some of those judgments are for the elected members of the country.
Right, that's really helpful. Well, to follow on from that then, if you look back at the last couple of months when we have seen this divergence in messaging that seemed quite sudden and quite drastic overnight, moving from that to then having the fiasco with Dominic Cummings seemingly breaking the rules but then not breaking the rules, I want to ask, and I know this is a bit rich coming from a panel of politicians, right, but to take the politics out of it, I'm wondering from a medical side and from your medical experience, has how this has played out in the public had an impact on the public messaging for government? Has this undermined it?
So I'm not going to discuss or describe the individual case, and you wouldn't expect me to do so. Of course. What I can tell you is that public messaging and compliance of the public are crucial inside a global pandemic. I actually think it's a balance. I think the population understand what it is we're telling them. So my job, along with the Cabinet Secretary and others, is to make that message as clear as we can to the people of Scotland. I have occasionally appeared on UK-wide media, but in the main, my role has been to try and make that messaging as clear as I can, along with the political communicators inside our population. And even when there have been occasions of travel or people doing this and the police have had to give out things in the beach or on the loch side, in the main, they have been exceptional and on the edge. The population, I think, understand the messaging in all four countries, and in the main have followed that guidance. And I think actually the public are smart enough to listen to that messaging themselves, even if they are annoyed by individual behaviours or of their neighbours, their friends, or those in the public eye.
Okay, thank you very much.
Thanks,
you.
Chair. And I have to say, I particularly enjoy Professor Leitch's contributions to Off the Ball with Tam Cowan on a Saturday afternoon. I always make a special point of listening to them now too. So there you go.
Cabinet Secretary listens to them with anxiety every week.
I bet she does, yes, indeed.
You get slightly concerned. It's the one place I'm going to overspeak slightly.
Fantastic. Great. We'll go over to...
Absolutely, you have that concern, I have to say. Can I just make one point?
Yes, of course.
On the back of Ms. Black's question, and that is the absolute importance of winning and then, even more importantly, securing public trust in what you are asking them to do, because we wouldn't be here. I can only speak for Scotland, but I think it does apply elsewhere. We would not be at this point with that our number looking the way it does, the numbers falling across some of the other key indicators, if the public had not paid attention to the key messages and what we were asking them to do. And what we were asking them to do is seriously restrict their lives and change their lives. So it is their progress that's been secured. Keeping that trust is really, really important, and that is why it is so important to us that we publish as much data as we can publish, that we are as open as we can be in explaining our decisions and the approach that we're taking and answering when things do not work as we want them to work and what we're going to do about that. That really matters, because as we move through each step, I hope, in coming out of lockdown, we need the public to stay with us, because we still have a virus and it does need to be suppressed.
Thank you. Cheers.
Grateful. There's division bells going just now, but they're not a division, so don't panic, anybody. It's just a sort of break in proceedings, so it can be reorganised for the next session. So that's what you're hearing in the background. It's just our normal day in Westminster just now. We now go across to Deidre Brock. Deidre.
Thanks, Chair. It's actually a sort of a follow-on to the issues around messaging. I mean, there have been at times some quite distinct differences between the devolved administrations and the Westminster government's approach to this. So, and particularly when the Scottish Government didn't align itself with the Westminster Government's decision to move out of stricter lockdown, and it shifted its messaging from stay at home to stay alert. I just wondered, is it those extra few weeks staying in lockdown and that stronger message that you think in Scotland that you think maybe has had this welcome impact on the R rate, and how does that compare to what's happening elsewhere in the UK?
So, excuse me, in terms of the R rate and what's happening elsewhere in the UK, I'll let Professor Leitch respond to that. I would look at it the other way around. I think by and large, Wales, Northern Ireland and Scotland have a very similar approach and have taken similar decisions at round about similar times, and have held to that stay-at-home message certainly for the first phase in moving out of lockdown. It remains really important, and we were very clear about that. But each government has to take, as Professor Leitch says, a judgment that they think is the right judgment for their situation and the population that they are serving. And it is absolutely the case that the scientific and clinical advice that comes through SAGE comes to us all. We have that very important additional element with our Chief Medical Officer's advisory group chaired by Professor Morris that then applies that where they believe it needs applied. And in there we have, of course, very important contribution from Professor Riker of St Andrews University on behavioural science, increasingly of value, not to diminish any of the other colleagues' value, but increasingly of value as we need to understand how people hear messages and how they behave in response to that. But each individual government then needs to, the politicians there, then need to take that it's the same, by and large, for each of the four nations, and make a judgment about what they think is the right thing to do. Our judgment was that in phase one, stay at home remained a really important message. We needed people to do that. We had increased the basis on which they could leave home, but essentially we still had them stay at home. And although there was some initial, I think Professor Leitch is right, there was some initial confusion on the part of the population about were they to stay alert or were they to stay at home. I think that was captured back from our point of view to what we needed them to do. I would say that our clear setting out of the rationale for our route map, what that means, how we go about determining the decisions that we take at each stage, has helped that public engagement and compliance with what we're asking them to do. And it is that that has helped to bring the virus level down to where it is today, as we've published those figures. Elsewhere in the UK, in terms of what's happening, and there's variations indeed, I'll let Professor Leitch respond.
There are variations. The Cabinet Secretary is absolutely right. The R number has taken on a kind of iconic status that it doesn't fully deserve. It is very, very important, but it is not the only important thing. And the R number is reassuring now in Scotland and across the whole of the UK, to be fair. But in a population of 60 million, you're going to have more variation than you are in a population of 5 million. So it does look as though some regions of England have higher R numbers than others, and you can see the local responses. I don't know them well, but the local responses in Manchester appear to be slightly different from the local responses in London and the South East. So you have to take the R number as one element of the data and information you get to then make the advice palpable to the politicians for them to choose. I think our messaging has been correct in Scotland. You would expect me to say that. I think the other thing we've done in Scotland is we've very clearly had political voices and clinical voices sharing that information with the public. We have done that absolutely deliberately. The politicians chose to do it, but then when they chose to do it, it meant the Chief Medical Officer, the Chief Nurse and I were prominent in telling the population, trying to get it across. And the off-the-ball remark from Mr Wisher is actually part of the plan. It's a sports show on a Saturday afternoon that gets 500,000 people who don't watch Channel 4 News. So to try and get to that population, to get them that same messaging about staying at home, about looking after their kids, about how they might do that and how they might protect themselves from this virus, I think has been really important in Scotland. And I was also going to mention, so I'll just emphasise it, I think we have underestimated the advice we've received from behavioural science as well as clinical science. They have taught us a great deal about how to message to young people, about what children need to know so they're not terrified but they are protected, and how to message to the group who are shielded, who are elderly, who are very nervous about leaving their homes. So we've tried to take that behavioural science advice, layer it onto the clinical advice, and then make judgments.
Brilliant, thank you. Listen, I do have another two questions, and they're in sort of fairly different areas. So if I can just turn to the very sad issue of COVID deaths in care homes in the UK, but particularly what difference there might be in the rates of COVID between larger private care homes and then smaller public sector ones. And if there is a difference, what might lie behind that?
So there is, I don't believe at this point, anything definitive on this, but there does appear to be some emerging indication that larger care homes have had more challenge and more incidence of the virus than the smaller care homes. That's not actually about the nature of the provider, whether they're public or private. It appears to be about size. But as I say, that is emerging indication, so I wouldn't even call it evidence at this point. There does need to be, I think there are a number of areas in Scotland about the landscape of social care provision that the pandemic is highlighting for us. Some of it is not new, if we're fair about that, and a general feeling, including in the care sector itself. I had a conversation this morning with the owner of Balhousie Care Homes, a private sector provider, where he indicated his desire to be engaged in that conversation about what would the future landscape of social care look like in Scotland. How might we fund that? How might we regulate it? How might we get the balance right between the necessary infection prevention and control to protect residents, not just from this virus, but from seasonal flu, from winter vomiting and so on, while still recognising that this is somebody's home and it's not a hospital ward. So how do you balance that in a way that does both? And that's not straightforward. So there's a lot of The pandemic notwithstanding, there is a lot of thinking and discussion to have, and we've said very clearly, I've said very clearly as a Cabinet Secretary, but so too as the First Minister, that we intend that discussion to happen. It's part of what we learned from this experience of the pandemic.
Thank you. And just lastly, I was wondering about the progress of the tracing app that the UK government is piloting, which seems to be undergoing considerable teething problems. I just wondered what involvement or oversight the Scottish government had in its development. Are you able to share that with us?
Yes, we have not had any involvement in its development. What we have said, though, is as it develops to a point where it is considered viable and the data flows are such that any data that is collected from those who download that app can flow into our data system and inform it, and therefore inform Test and Protect, then we will be wanting to consider how we might use it. But at this point, I don't think the app's development is at that stage yet, and I understand that there are still issues to be resolved in terms of its operation and how it then links into the Public Health England's, NHS England's own contact tracing operation. So it's not on the immediate horizon, would be my understanding of where we are.
But sorry, Cabinet Secretary, are you then saying that the Scottish Government had no involvement in the creation of the sort of further development of that tracing app? Because it's certainly been mentioned a lot by the UK Government, and I'm surprised to hear that.
So we had an understanding of what it did, and we had our respective officials had communication about if it was to work for us, what would we need from it and how would the data flow and so on. But in terms of its development and decisions about whether or not it, now we're testing the boundaries here of my technological understanding, but whether or not it connected to Google or Apple and so on, all those issues around that were not decisions or views that we were party to. We set out, if you like, the important principles in terms of confidentiality, its ethical use and data flows that would need to be addressed and answered for us to then engage with it once it had proven itself, and even in its development in order to take account of all of those issues. But my understanding at this point is that there is further work to be done before, for England, it would be considered an active element of their contact tracing and testing and contact tracing exercise. So we are where we have been. If it gets to a point where it can answer those questions and it has that value, then we certainly will use all the tools available to us to enhance our Test and Protect exercise.
Thank you.
Grateful. Thank you. We go over to Sally Ann Hart, who looks like she's in a House of Commons office. Sally Ann.
I am. Thank you, and hello to Cabinet Secretary Freeman and Professor Leitch. I just wanted to quickly, before I got into my questions on scientific evidence, just slightly pursue something about COBRA. You seem to be, Cabinet Secretary, very concerned that there haven't been any COBRA meetings since the 10th of May, and obviously that's quite concerning. So I understand that COBRA is called to make urgent, rapid and effective, and take urgent, rapid and effective decision making and pursue such action. So do you think Scotland is still in a situation where COBRA meetings are essential? Is that a worry to you?
So I think COBRA or a version thereof is essential.
But not necessarily COBRA.
Well, but that was what we operated with. And if you think about the dates, the 10th of May was before the first review date in terms of whether or not we moved from lockdown to any easing of that. So it is a concern to me that we have gone so long, more than a month, without that, and we're coming to another review date with no indication that that will be stood up again. So COBRA is the device that has worked and been used. In its absence, I think there needs to be an alternative to that that operates at that level. And its absence and then the disbanding of the MIGs with all the other elements that I've already described is a matter of concern if we are to continue the four-nation collaborative approach at ministerial level across governments. So notwithstanding my weekly conversations with Mr. Hancock and other colleagues, at governmental level, that
so it's ministerial level. Thank you for that. I'm just going to move over to the scientific evidence available, and so I understand that the Scottish Government, in addition to representatives on SAGE, has appointed its own Scottish Government COVID-19 advisory group. And I wanted to know whether you read all the scientific evidence from that advisory group and how you use that to inform your policy decisions.
So and I'm sure Professor Leitch will want to contribute to this in terms of the scientific evidence and how that group operates. As I've already said, there are members of that group who also contribute to either SAGE through Professor Morris or our Chief Medical Officer, or to the SPI-M and SPI-B, I think, are the two other groups that they are engaged in. So they will take the various pieces of evidence that come in through those routes and attempt to reach a consensus view, and that is the view that will come to us as politicians. And in the case of our additional advisory group, that is then looked at with particular relevance to the situation in Scotland, and that is, as Professor Leitch has said, the circumstances of our geography, our island communities and so on, and the circumstances of our demography as well, in terms of what our population looks like, and give us advice on, for example, areas of shielding or the Test and Protect programme and its importance, surveillance work in order to understand the prevalence and the nature of the virus in the community. And they tend to do that. We do receive, they publish papers. They've published a whole range of papers most recently that they have produced. And we do tend to do that by means of Zoom or webinar and the presentation of slides and information and a discussion with members of that group.
Very informed. So when it comes to dissenting views, are they based on politics or science, and how do you weigh up dissenting views?
It depends what the dissenting views are on. If they are dissenting views on the science, then Professor Morris is very good, as indeed is Professor Leitch and others, of pointing to where there may be another paper produced that doesn't have exactly the same position as the consensus approach has been reached, and helping us to understand that. I should say, I think it's Professor Debbie Shriver from Edinburgh University is also on our group. In terms of decisions about whether or not we will ease the measures for those in the shielding group, and if so, in what way and how, those are exactly, as Professor Leitch has said, judgments made either by individual cabinet secretaries in particular instances, or collectively with our First Minister about what we think are the right things to do. So we will go through an exercise that has begun, that is looking ahead to the review date next Thursday, and the decisions that we will make about any easing of more lockdown measures next week, setting dates for those and so on and so forth. And that will be a collective decision by Cabinet, which will, of course, include our First Minister.
When you're looking, thank you, Cabinet Secretary, when you're looking at the evidence, so you're looking at the evidence on the health, do you also look at the economic evidence as well as the society, you know, the damage that is happening to society as a whole? Do you look at that evidence as well when you're making your decisions?
Yes, absolutely we do, and that's why I said it was a collective cabinet decision, because my colleague Ms Hislop, who is our Economic Secretary, and Mr Matheson, responsible for transport, Ms Campbell for communities and others, and of course our Deputy First Minister, whose responsibility also includes education, both preschool, primary school, secondary and higher and further education, all have perspectives in terms of the impact of this virus on their areas of responsibility. So that collective decision making is critical so that we can try and get the balance. I think earlier Professor Leitch talked about the headroom that that has been created. It's not huge, but it's there, and the decisions about effectively what you're going to spend it on, and that is reaching a balanced view across all of those areas, mindful of what we describe as the non-COVID harms, of which there are non-COVID harms in health too, as well as in the economy and elsewhere.
Thank you. And do you put a particular weight on any particular aspect, whether it's economy, health, society? Is there any, when you're looking at evidence and you're putting weight on evidence, which one is put the most weight?
So I should say, I think Professor Leitch wants to come in, so perhaps after me, but I should say that we don't weight it in that way. We are very clear that our primary responsibility to the population of Scotland is to take the steps that we consider necessary to save as many lives as we can, and that is our primary duty as a government. That then does, though, take you into consideration of economic harms, because we all know the impact of, for example, poverty on a nation's health. So these are difficult balancing decisions and judgments to reach, but we don't do it by some kind of different weighting to different areas, and it does depend, and will continue to depend, on where we are in the journey of suppressing and then managing the existence of the virus in our communities, which we will be doing until a vaccine that is effective is produced and we're able to use it. I don't know, Professor Leitch, if you want to.
So it was a couple of questions ago, and I felt it appropriate to make some remarks about the complexity and volume of the science in this area. I have never known the scientific community globally to work at this pace and at this volume. So there has to be a filter. There has to be a filter for me, because I simply cannot read it all. Yeah. And then there has to be a filter for the Cabinet Secretary and for the First Minister and other politicians around the world. So I have members of my team who watch the WHO press conferences. I simply cannot watch every WHO press conference. So we have to use some kind of filtering mechanism to then take the 40 new publications per day that I get in an Excel spreadsheet at the end of each day and take what we want from them and take what we need from them and feed them into the advisory groups, then to the Cabinet Secretary, then to the Cabinet. I think it's important that politicians get a broad range of the science, but there has to be a filter mechanism, which is what SPI-M and SPI-B and SAGE and the CMO's advisory group in Scotland are attempting to do. That doesn't mean that I still don't get surprised when the Cabinet Secretary says, did you see what it said in the SPI-M minutes? And I have to start paying attention again because I didn't think she was reading them. So there has to be layers of advice, and then the politicians have to be able to take that. And the second point, I think, is one the Cabinet Secretary has already made that I would reinforce. In Scotland, we are spending quite a lot of time with politicians explaining the science. So we have, in fact, we've got one after this. We've got one today on the serology of how this virus works. That's a fairly detailed clinical and scientific tutorial with scientists, clinicians, and politicians to understand how the actual deep serology of this works. And I can tell you that the First Minister and the present Cabinet Secretary are slightly more interested in that than I expected them to be. So, but that has got to be helpful. If we can all learn as much as we can about these, that doesn't take away the necessity for the question you just asked about what do we do about construction or business or economy. But the more understanding we have of the clinical science behind this, then the better those decisions will be, I think.
Can I also just say, of course, there are other advisors in Scottish Government. We have a Chief Economic Advisor and others who are all providing, from their professional expertise, advice to their Cabinet Secretaries that also takes account of the health advice. So one of the things that Professor Leitch does is spend time with, for example, the Scottish Trade Union Congress or with sports bodies or with others in government, making sure that in as much as the health advice and the science is relevant to their area, that they understand what that is and can take account of that as they work out, for example, how we would restart the economy and what would be the right safety measures, if you like, to require. And we've seen that in the construction industry's 5-stage plan, I think, for restart. And today they move into the second of those stages because as an industry body with all those businesses and companies and their unions, they have worked through the first of their stages to get to a point where they're now safe to move into the next
Thank you, Cabinet Secretary. I'm just conscious I want to let you guys away by 4 o'clock because I know how busy you all are. So I'm going to come across to Andrew Bow, who's done us a favour by issuing a press release in advance of the session, detailing his questions, and they're very possibly unreasonable. They're not particularly charitable to yourself, Cabinet Secretary, but I'll leave Andrew Bowie to give us the questions he's already released as a press release. Andrew?
Thank you, Chair. I always like to be helpful, as you are well aware. Cabinet Secretary, on that, the Commonweal think tank has described the impact of coronavirus on care homes as an unmitigated disaster and the single biggest failing of devolution. Do you agree?
No, I don't agree with Commonweal. I think that we took the steps that we took in terms of care homes going right back to the beginning of March, based on the information and the evidence we had at that time. Many of the steps we took, in fact, were common across the 4 nations of the UK, in terms, for example, of discharging patients to care homes, although the majority did go home. So that's not the view that I would take. That's not to say that I don't think, with hindsight, there are lessons to be learned and decisions that were made at the time that I would not necessarily make now. But the other point I'd make as well, if I may, Mr. Bowie, is that from the outset, we have said, both the First Minister and I and other Cabinet colleagues, is that in dealing with this pandemic, the unprecedented health crisis that our countries face is not a place for normal party politics. Party politics is not in this space.
I agree, which is why I was quoting the Commonweal think tank, which is not a think tank that I don't think Conservative politicians go to incredibly often for evidence. You suggest that lessons should be learned from the circumstance. I would suggest that that's a bit of an understatement. How many COVID-19 deaths in Scotland have occurred in care homes?
I don't have those figures to hand, but as you know, we publish through National Registers of Scotland weekly detailed data on the number of registered deaths in Scotland. And what I do recall from yesterday's publication is that thankfully the number of deaths in care homes, as elsewhere, is declining. That is a positive step. I do think it is an indicator of the hard work of care home workers and of the additional measures that we have put in place since the 13th of March and incrementally ever since, although important for me to say that none of that diminishes the loss and the heartache that has been caused to relatives of those who've died.
Absolutely. Well, the number is, I think, which was published earlier, is 1,818 COVID-19 deaths in Scotland have been in care homes, as opposed to 1,000 1,815 in hospitals. That's 48% of all deaths in Scotland as a result of COVID-19 coming in a care home setting, more than in a hospital setting. Do you then regret the decision to send home 1,431 residents from hospitals into care homes?
The thing to understand about what we did there and have always done in terms of discharging patients from hospital to care homes is that the first and most important thing that should happen pre-pandemic and during the pandemic, covered in our guidance, is the clinical assessment on the part of the hospital and the care home about the appropriate place for someone to go, remembering that the people we are talking about no longer clinically require to be in hospital. And as we know, for older people in particular, the longer you stay in hospital past the point where you need hospital-based treatment, the greater you risk damage to muscle wastage, to cognitive ability, and to a range of other important health measures. So that should always happen, has happened during the pandemic. In addition, the guidance issued to care homes on the 13th of March set out very clearly what we required from them in order to take particular measures to address the risk of the virus. First of all, a significant reduction in communal activities, no communal dining, no communal socialisation, the significant reduction in visitors, except for particular cases, end-of-life care, dementia care, and the implementation of infection prevention and control measures, which they should be providing in normal course from that national manual. And that guidance has been updated subsequently. We have introduced much stronger support from our primary care and clinical teams in the community to support care homes. We have taken additional steps in terms of financial resourcing. And of course, from the 19th of March, we stepped in order to provide PPE direct to care homes in circumstances where their own supply chains were failing as a result of the global demand.
Thank you, Cabinet Secretary. I listened intently to that, but I mean, 1,818 deaths in a care home setting is a shameful statistic. Of the 1,431 patients discharged from hospitals back to care home settings, are we able to say yet how many of them were tested before they were sent back?
I'm not convinced, with respect, Mr. Bauer, you did listen intently, but in terms of your second question there, that work is underway, and when we have that data and it is validated, we will publish it.
Okay, thank you very much. As you said, Cabinet Secretary, lessons to be learnt there. Given that only 36% of care home staff at present are being tested across Scotland, why has it taken until the last few days, as you said earlier on, to come to an agreement with the Army about using mobile testing centres for care home workers? Surely we should have been looking at doing this weeks, months ago.
Mobile testing units were being used for other areas of testing, and the decision has been taken in order to take testing to care homes. Those mobile units are best used in that area, and that is now what is underway.
Okay, thank you. Thank you, Cabinet Secretary. I'll let other people ask questions.
Thank you. I think it's also worth noting, because I know care homes comes up as an issue with the Scottish Government quite regularly, but in the space of a month, 25,060 people were discharged from hospital into care homes without being routinely tested in England. So this is an issue. This is an issue that seems to be.
I agree, but this is a committee looking at COVID-19 and Scotland, and we're not investigating what's happening in England.
I'd just like to know the Cabinet Secretary's feelings on this one, because I mean, where there's heat in the debate down here, we see this all the time, there is a general political consensus about the way forward. That seems to have totally broken down in Scotland, and I know an almost daily request for you to resign by the Scottish Conservatives in the Scottish Parliament. Is this hampering your ability to do your core task as a Health Secretary in Scotland?
No, it's not hampering my ability to do my core task, because I am absolutely determined to do that job and to continue to do it. I do regret it, though, because at the very outset, I think from memory, the 17th of March, in a debate in the Scottish Parliament chamber, the leader of Scottish Conservatives, Jackson Carlaw, said very clearly, and his comments were very welcome, that this was not a place for party political point making. It was not a place for pejorative rhetoric. And I regret, in as much as that has shifted, that is the shift, because I think that we should recall that what we are doing here is addressing a pandemic, a global pandemic of a virus that is relatively new, that the scientists and the clinicians and indeed undoubtedly the politicians are learning about all the time, that those initial steps just on delayed discharge was shared across the 4 nations, and that it is easy, and I understand it, to look now with the knowledge we have back at decisions that were made at the time with a different and lesser level of knowledge and say we should have done X or Y then. But we didn't have hindsight when we made those decisions. What is, I hope, not in question is that any of the decisions that I have made as the Health Secretary or the Scottish Government has made collectively have been made with anything other than the best of intent to do the best job we could with the information we had at the time when we had that information. Undoubtedly, as we go through this pandemic, and I hope we progressively go through it to see its end, we learn lessons as we go, but there will be a time, in the fullness of time, for a proper review of all of those lessons to be learned, the mistakes that were made, what we should have done, what we did do right, what we should have done better. That's important, not just for scrutiny and public confidence, it's important for lessons to be learned to aid our policy making and our thinking as we go into the future.
I mean, we know how hard you're working as the Health Secretary in the United Kingdom and all the Health Secretaries across the United Kingdom, and it's just this unfortunate little feature that we've got. But I know Deirdre Brock's keen to come in. Deirdre.
Thank you. Thanks, Chair. Listen, it was really just about the discrepancies in reporting methods between, well, particularly Scotland and England, I guess, but other countries in the world as well that don't seem to be using unconfirmed possible COVID deaths. It seems, looking at the Financial Times, for example, and comments from ONS officials, that the Scottish definition used to record COVID deaths is quite a lot wider than in the rest of the UK. Is that right?
I believe that is right, but I think the main point here is to recognise that there are differences in recording methods and in definitions, if you like, not just within the UK, but with countries around the world. So you need to take account of that before you make absolute comparators and state with certainty that one country is doing better than another in any particular respect. You need to go below the headline figures, if you like, to understand where might there be differences in recording or reporting, in time lags or in definitions. I have learned a very great deal, I have to say, in the 5 months and more that we've been addressing this, because I think it is important to recognise on the record that the Health Directorate in Scotland and my officials have been working on this for a very, very long time and working very hard to do that. But one of the things, the many things I've learned, is the importance of doing the detail and looking beneath headline figures to understand whether or not there is a discrepancy, there is a real difference, or whether or not we simply don't know whether there is sufficient comparison to be able to make any kind of judgment.
I just wondered, Professor Leitch, is that something that you might be able to comment on and just perhaps outline some of the reasons for those discrepancies, or at least the discrepancies themselves?
So I know what happens in Scotland, and you would have to ask the other countries' representatives to describe what happens there. We count every death that has COVID-19 mentioned anywhere on a death certificate. And death certificates are not simple documents. You may well, forgive the shorthand, you may well die of a stroke but at the same time you may have asthma and COVID-19. If COVID-19 appears anywhere on that death certificate, you will be counted in the COVID-19 deaths. Every single death in this pandemic is completely tragic, but they are not all the same. So our clinical element of that is to try and learn as much as we possibly can from every death and the spread of the virus, and that's what we try and do. My only other remark would be in shorthand to say that simplistic country comparisons are almost always wrong. Whether you're comparing yourself with Italy or France or South Korea, anywhere where you see a table with deaths and one variable, they are almost always incorrect. You have to, as the Cabinet Secretary said, truly understand what that country is doing, looks like and has done to get anywhere near country comparisons. And I don't think we'll actually know the nature of this global pandemic and its effect across global populations for months to come.
Grateful. And no, Wendy Chamberlain's keen to come in on contact tracing. Wendy?
Thank you very much, Chair. My question just around the test and protect strategy that's now in place, and just a couple of questions there. We know the testing capacity in Scotland is about 15,000 a day, and we've already discussed how we encourage people and members of the public to engage with that. And Cabinet Secretary, we know of your commitment at the end of last month to test all care workers, home workers on a weekly basis. But my question is the number of tests that are currently being carried out actually enough for the test and protect strategy to be effective?
So we've only got 1 week's data of test and protect because, of course, it was stood up from the 28th of May. And in terms of the number of tests that were positive that then triggered the contact tracing, that is a relatively low number, 681 in that first week who had tested positive for COVID. That's a relatively low number, but actually it is in part a reflection, I think, of two things. First of all, that the virus level in Scotland is low, as evidenced by that R number that's been published and other indicators. And so as you ease lockdown, test and protect is there as your armour, if you like, to ease the lockdown. So a lockdown suppresses the virus to a very low level. We need it to be lower than it currently is, but it suppresses it to a very low level. You can then, ease lockdown measures, but you use test and protect at that point, if you like, to hunt down the virus and contain it. That's its job, through contact tracing and people isolating, and then so you're doing it in groups of cases or individual cases to prevent onward transmission. That's the point, and it's there as a critical element in order to ease lockdown and allow more movement by people, more contact between people, recognising that carries a risk. So it's not there on its own. It sits with other measures like the 2-metre distance and the wearing of face coverings and hand washing and all of those important public health messages. So at this point, I think it is low as a reflector of where the prevalence of the virus is in the community, the progress made through lockdown. I also think, though, as I said earlier, there is more for us to do in the messaging that we're putting out to the Scottish public, which is different from what it has been. Now we're saying if you've got symptoms at all, don't wait to see if you're a wee bit better tomorrow. Get that test booked and let us then take it from there.
Cabinet Secretary, you mentioned that the Public Health Scotland report with the first figures around test and trace, and that was kindly circulated to us all as committee members. So what I noticed in that is the summary of that still states that we believe that the first case in Scotland was the positive case in Tayside on the 1st of March. Given that we have obviously had discussions around the outbreak in Edinburgh and the fact that there seems to be a general acceptance that COVID was circulating in the communities prior to then, is it still the government's position that the 1st of March was that first case?
Well, the 1st of March is the first case that was reported to us. And what is interesting and what where Jason and I are about to go into is a conversation with scientists around that serology. You'll have seen the Glasgow University report that essentially looks at how you trace the strains of the virus, the kind of family tree of the virus, and did that for the strain that was present from the Nike conference, and shows very clearly, I think, that the response of health protection teams at National Incident Management Report response, the contact tracing that was done, successfully ended that particular strain.
Yes.
That didn't end.
But we expect it was there in February, I think, I suppose is what I'm asking.
And that is what they indicate. But at that point, no cases were known to us. The first case was that case that you refer to.
Okay. Thank you, Cabinet Secretary, and thank you, Chair, for letting me come in again.
My pleasure, and thank you, Wendy. Just one last question from me, because I know you guys have to get away, and it's about this new Joint Biosecurity Centre, and maybe this is more for you, Professor Leitch. Just what is Scotland's relationship to this, and what value do you place on its activities, and what do you think it's going to contribute to the ongoing debate?
So anything that helps us with intelligence gathering, with intelligence sharing in a safe way, and making more intelligent and data evidence-based choices about how to move through the stages of this pandemic is welcome. We have been peripherally involved in the decision-making around that UK government-based thing, and a bit like the tracing app, I think it's fair to say that the Cabinet Secretary and I would be of a mind that if it were useful, if it fed into our data systems and our data systems could feed into it, and we were comfortable with both the security of it, the privacy of it, then we would of course engage in it. It's important, a bit like the tracing app, we do not require it. We have our own level of intelligence gathering. Our chief statistician sends us modelling data once a week. We have layers of data gathering and data intelligence that we can use for Scotland. However, if the WHO created a global database of coronavirus cases and information, of course we would engage in that process if it were safe to do so. And equally, if the UK government decides to do that with this Joint Biosecurity Centre, and we can engage in that safely, and that adds intelligence to our decision making, then my advice will be to engage in it. But I don't think all of those criteria are yet met.
Excellent. Well, thank you both ever so much. Fascinating session, and thank you for answering all our questions so fully and comprehensively. I think there was a couple of outstanding issues that we might get back to you about, but for today, thank you for your involvement and participation. Order, order.
Thank you. 2020.
The proceeding has ended.
How do you mean no more commission?
Well, no one in Scotland can commission an idea. You know, if I went to BBC Scotland and I said, oh, I've got this great idea for a sitcom, I've got this brilliant idea for a drama, you know, no, there isn't one person in Scotland that can okay it unless it goes through London.
Good morning and welcome to another edition of Full Scottish. What's happening today?
Hello and welcome to the Full Scottish here on Broadcasting Scotland.
Scotland is going to be an independent country.
That need, that desire for independence is ever stronger than perhaps it was in 2014. So there's an obligation that we've got to give leadership to that campaign. That's what Nicola Sturgeon, as our First Minister, has been doing.
My feeling about Boris Johnson is he can't be trusted on anything.
That is now and forever will be known as the rape clause.
I'm old enough to remember going into Europe in '73, and I remember how much of a razor's edge that was a balance stone. And I think we made it by 53%, if I remember correctly, for going in. And ever since that time, England particularly has been pretty much schizophrenic, down the middle about whether it felt British or whether it felt European. And that schism, that crack has remained throughout English society ever since.
Scotland means business. Scotland's voice won't be stilled, it won't be silenced, it has to be heard.
About the work that's been done by Broadcasting Scotland in giving community activists, yes activists, Scottish activists a platform other than the traditional media outlets.